All right. Well, hello, everybody. My name is Dr. Jam Caleda. Thanks for taking the time on this sunny day to learn with me. And if I look away from the camera again, I'm looking at my notes here. So this presentation is geared more toward for people who have either heard a little bit about regenerative injection therapies or haven't heard anything about it at all. It is more geared for people for patients. However, we do get into some of the nitty gritty part of the material a little bit later on. Feel free to ask and type in the comment box if you do have any questions. But if you can, I have a Q&A at the very end, and that's when we can have a little bit more of an open discussion. Just have to let everybody know that I have no affiliations with any of the products or the companies that I am going to be presenting on. However, I am a naturopath practicing here at Integrative Naturopathic Medical Center. I've been practicing for 8 years now with a considerable interest in pain management. And I can confidently say that I'm well trained here at the clinic, and we're an experienced authority in regenerative therapies. I have performed over 7,000 image guided procedures since I started my career, and that's a rough estimate. And so we'll kind of go through these first few slides here pretty quickly so we can get to the meat of things. Well, what are you going to learn today? Well, we'll learn mostly about the what, who, where, and how of regenerative injection therapies, what the process looks like from the patient perspective, the effectiveness of the treatments, obviously, and how we really utilize these treatments to practice holistically. And then again, at the end, I'll be open to questions that anyone might have. Okay, so we are a naturopathic clinic. These procedures were originally designed by medical doctors, but in the naturopathic sense, we do want to utilize this in a holistic way. And that means really engaging in the patient-centered model and using the approaches that we have in naturopathic medicine and apply it to regenerative injection therapies. And I'll discuss that later on in the webinar. So, what are regenerative injection therapies? Well, regenerative injection therapies are a class of treatments that are designed to stimulate regrowth of non-connective tissue. That's a fancy way of saying that we can help heal ligaments, tendons, bones, skin, and in some cases, nerves and cartilage. It's been around for a while, and it's very safe and efficacious in what it does. And for our purposes today, we'll be talking about two different classes. One is prolotherapy, and the other is orthobiologics, where we use different solutions to achieve the goals that we want. And just a little bit of history behind these procedures. Well, it was, like I said, it was initially developed by medical doctors in the 1920s, and it was actually developed to treat hernias. As hernias penetrated the abdominal wall, doctors were utilizing different techniques to try to tighten up those abdominal walls to prevent hernias from happening. But in the 1930s, Dr. Hackett, who was a general surgeon in Chicago, actually started using it to treat the working class as well as veterans coming back from the war. And he found that it helped with subjective pain scales and functionality. And then in the 1950s and the 1970s, it did gain more popularity with other medical doctors and was utilized in different arenas of medicine. And this is when it particularly started branching off into performance and using it with athletes and other injuries. It's interesting to note that it never got public recognition or FDA recognition because of, conflicts of interest with pharmaceuticals, which were getting pretty advanced, or I should say more developed at that time. And since the 1980s, it's been continuously growing with notable doctors and organizations getting involved. So The types of regenerative injection therapies. Again, for this particular webinar, we will focus on the two different classes. Prolotherapy is the first one, where we utilize an irritant solution such as dextrose and historically in the past sodium morowate and pumice stone to stimulate an inflammatory response that allows healing of tissues. On the other category, we'll be talking about orthobiologics. Now, what are orthobiologics? That's a fancy word. It's the use of biological material that is derived from humans, mostly you, and we'll get to that mostly later, mostly you, where we extract material and then inject it back into your tissue to help stimulate that growth. And in these classes of injection therapies, we have platelet-rich plasma. I'll also be referring to that as PRP. And we have mesenchymal stem cells and something called exosomes. Unfortunately, I won't be talking too much about mesenchymal stem cells and exosomes, but I will make note of it because there are places that's more widely utilized outside of Canada that we can gain access to that. But for our purposes, we'll be talking about mostly about prolotherapy and platelet-rich plasma. Now, who is this for? This is probably more interest for patients. Well, injuries. Injuries can be divided into two classes: acute injuries and chronic injuries. Acute injuries tend to be, as long as it's not an emergency and as long as it's not an issue where the patient's health will further deteriorate within a short period of time, we can treat it with regenerative injection therapies. Typically, acute injuries are injuries with pain that has been causing pain in less than 6 months. This includes sprains, tears, and in some cases, broken bones. This can also be caused by motor vehicle accidents and sports injuries and falls. Chronic issues is where typically patients come and see me mostly for, and these are syndromes and symptoms where people experience for more than 6 months, and they tend to be more complex with multiple compensatory patterns. So, for example, the injury could have been a motor vehicle accident 30 years ago, but as time goes by, the body compensates and other factors start to affect the way that the patient is presenting, and nondescript pain and non-specific pain will start to present in other areas further away from the original injury. Just a little bit about that. It's these chronic conditions are a lot more difficult to pinpoint. However, with the tools that we do have here and the experience, we do have successful results in understanding the chronicity of someone's injury. Ligament laxity. Well, what are ligaments? Ligaments are soft tissues that surround joints, and these ligaments function to provide stability while a joint is in motion. So as you can see here in this particular diagram, we've got a picture of a shoulder, and if we remove the skin, we have this fibrous material that surrounds the shoulder joint. Now, this can lead to injury to these tissues, can lead to non-specific pain, usually indicated as soreness around the particular joint that can also radiate away from the joint. And again, these reflect the compensatory patterns in the body. Usually, patients will come in complaining about this nondescript pain, and we can kind of determine the severity of ligament laxity by how far people feel referral pain patterns away from that joint. Now, arthritis. This is I think it's a big word that people throw around lightly, but I find that a lot of people kind of come in with the idea that arthritis may be just a normal part of aging. And I think that's kind of the reputation that arthritis has gotten. And most medical doctors in the conventional field find that it's just a part of life and there's not really much you can do about it. You can kind of wait till it gets bad enough until surgical intervention is appropriate. But most conventional models will treat it with medications or conservative therapies like physio and massage until it gets bad enough for surgical intervention. So it's defined as an inflammation and swelling of one or more joints. There are hundreds of different types of arthritis, I think arthritis, which are different disease processes that present as joint pain. It's important to know that the risk factors that are non-modifiable, meaning the things that we can't do anything about, include genetics. It can run in your family. Age is a risk factor. Sex at birth. For women tend to have more autoimmune type arthritises and men tend to have more osteoarthritis, which the mechanism of action of how that happens is a little bit different. And then if you see in this slide, I've got a few things in italics, and these are modifiable, what we call modifiable risk factors, and things that we can actually prevent and modify throughout our life. And this is obviously previous injuries. We can prevent injuries from happening by being competent in movement. Obesity, metabolic syndrome, insulin resistance, and diabetes. These are really big factors that contribute to arthritic degeneration. And as naturopaths and functional medical doctors, we really try to address those as well. Physical activity, or even lack thereof, excessive physical activity can be a contributing factor to arthritis, but non-movement or immobility can also lead to that. And obviously, diet and stress. These are some of the things that we do make note of. Now, this is a slide that just shows that there have been a significant amount of studies regarding regenerative injection therapies. I will talk about this a little bit more in depth in later slides, but I just wanted to show that we've been looking at this stuff for a long time, and the conventional model is that it's still up for debate on its efficacy, but I believe I have explanations on why that is still occurring. And again, I'll touch on that a little bit later. Prevention and growth. This is another reason why people seek these injection therapies. We do take note of how these injections work, and there are in vitro or cellular studies and models that look at the effect that prolotherapy and PRP has on cells, and we're actually able to utilize that in different ways. So dextrose prolotherapy has been shown to promote healing of existing tissues, and people will likely come back after their initial treatment and utilize these procedures as a way to prevent further damage in the future, or even maintain quality of life with reduced pain. So anything else that I want to talk about here? No, that's pretty good. So common treatment areas. So when patients come in, there are many areas. Obviously, I focus on musculoskeletal areas, but this is a typical percentage of what people come in and see me for. So a lot of people have knee issues, low back issues, and hips, and shoulders. Those are typically the four most common areas that I treat. It's not uncommon that multiple areas are affected. Again, referring back to those chronic injuries with compensatory patterns, it's not uncommon that someone will have an old injury that will decompensate the body. And let's say, for example, they've got an old knee injury that they tore their ACL when they were in their teens, and then they come in as a 45-year-old and have also noticed that not only is the knee painful, but also the low back. So those are kind of the things that we treat concurrently. And it's important to note that it is possible to treat them at the same time. So some of the common conditions and diagnoses that I do see, excuse me here. We did talk about arthritis, but things like sciatica, pseudosciatica, frozen shoulder or whiplash injuries, these are very common. And a lot of times we don't really understand the underlying mechanism of action, or people are unfamiliar with why these issues really happen. But we can most of the time trace it back to damaged tissue or ligamentous instability. A kind of interesting one to note here is at the very bottom, there's a term here called Ehlers-Danlos syndrome, which is a genetic condition in which the ligaments, connective tissue of people with this disorder fail to grow correctly and can really lead to excessive ligamentous laxity. Okay. And other diagnoses that contribute to pain. It's important to understand that, underlying issues are possible contributors to pain. And these underlying issues can be other organic diseases. And as naturopaths and functional doctors, we do want to achieve the best possible outcomes. And there are tools that we have, like injection therapies, that are really fancy, but we also have to work on the underlying, on the whole body. And that's how we achieve the best results. Okay. So some considerations of candidacy. The contraindications are quite clear. If you have allergies to any of the ingredients, active infections and active cancer, active gout, these are clear contraindications for injection therapies. And we will, find other solutions to help you achieve your goals, or control those previous diagnoses before we consider your candidacy. Current and regular use of anti-inflammatory medications. Now, this is really important because things like aspirin, ibuprofen, Advil, they can interfere with the process of healing, and they can interfere with how we utilize these substances to regrow tissue. This also can occur with medications which alter immune function. So, taking a clear history and indicating what medications you're on with your practitioner is very important. Some cautionary things that I also take into consideration, and doesn't necessarily refrain you from getting treatment, but we want to make sure that you are getting the right treatment. Obviously, if you've had an acute injury that isn't an emergency or an urgent care referral, we would make sure that you do get that help if you need it. An acute flare of an autoimmune arthritis is something that I will always take into account. And obviously an acute fracture. We do help people heal quicker with acute fractures, but we got to make sure that it's stabilized first. And again, not a referral to the ER or urgent care. And the risks. So there is no free lunch with anything that we do. And we do try to make it as least uncomfortable and with minimal side effects. Over the history of these treatments, they are considerably low risk, but with everything, we do have to understand some of the things that we're undertaking. So the most common side effect is pain or bruising at the site of injection. That is happens to about 30 to 50% of people who undergo these treatments. Depending on the site, there are tissues, particularly blood vessels and nerves that exit the spine. We utilize imaging techniques here to ensure that that doesn't happen. But most of those types of punctures are either rare or self-limiting under the guidance of experienced doctor. And the most serious side effect, but the most extremely rare, is an infection. Anytime you puncture the skin, whether it's in here or outdoors, there will always be a risk of infection. And so these are kind of the risks that are associated with this procedure. Now, how does this work? How do regenerative injection therapies work? There are three major phases. The first is a inflammatory phase. And if you can see here in this graph, that inflammatory phase initiates with needle trauma from the actual injection and the injection of the material itself. This will create kind of a scaffolding of cells, and it will recruit other cells into the area. And this inflammatory phase kind of melds into the next phase called the granular phase, which is described by the granular appearance of cellular tissue under a microscope. And this can last anywhere between 1 to 2 weeks, just depending on the patient. And then after that, you get this recruitment phase, or what we call the proliferative phase. And I like to think of this as where the meat actually gets filled into the scaffolding. And this is where most of the remodeling of the cells and the tissue takes place, and how the tissue is reconstructed. And this is just another depiction of that process, where you've got the inflammatory response here on the left. And as you can see in the proliferative phase, there are more cells that are being recruited into the area, and ultimately a remodeling phase where the tissue is healed. I believe, yeah. Okay. I'm just going to make note and ask if anyone has any questions so far. And if you do, you can go ahead and type it in to the chat, but it seems like everyone's good to go. So what to expect? Well, we can expect in the initial appointment, expect to have a comprehensive history and physical exam. A mentor of mine once told me that you can really find the diagnosis and the most appropriate treatment, and if you pay attention and find 80% of that comes from the history. Obviously, we'll do a complete physical exam of the joint and ensure that we have the most appropriate sites laid out and determined. And then it's usual that I use an ultrasound machine to determine the integrity of the tissues that we're going to address, and possibly the level of injury. And sometimes, I miss something, or I don't understand why someone is feeling something or presenting a certain way. And the ultrasound machine or imaging really does help with establishing those diagnoses. And then the procedure itself. The procedure itself is pretty quick, and it takes about anywhere between 10 to 30 minutes, just depending on the area itself and how many sites we need to treat. It's an in-office procedure. So I'll start with sterilizing the area. Let's say, for example, a knee. I'll sterilize the knee, and then I'll drop the materials. If it is prolotherapy that we're using, I have the materials right there in the office, and I'll draw them right up in the syringe. If it is PRP, or platelet-rich plasma, that involves the patient going into a lab appointment prior to the visit with me, where our lab technicians, who are fantastically trained, will take blood from you, and we'll process that blood through
the word is slipping my mind right now, but through a centrifuge where we separate the elements that we need, and we'll extract those elements and prepare it for us. And then you'll come into the room again, and the procedure will take 10 to 15 minutes. You'll expect to feel a needle poke. Sometimes I try to use the most gentle techniques that I've learned over the years, but you'll feel a needle poke and occasionally a deep ache or a kind of a deep soreness. Some patients have described it as kind of like a deep tissue massage. It's mostly very tolerable, as I do like to use quite a bit of anesthetic. And again, with that anesthetic, you might experience anesthesia for around the area for anywhere from 30 minutes to 3 hours, just depending on how quick your body metabolizes it. Okay. Now, afterward, so most people, the vast majority of people will walk up and go home and go about their day. But I always try to communicate to expect an increase of pain anywhere from 3 days to 3 weeks. And everyone is different in this sense. And we all have techniques, or I advise on techniques to help to reduce that discomfort. But most people will return to normal activity in a gradual way. I'm a big proponent of movement, as movement does provide many different things other than blood flow. It provides signals to the brain that reduce the trauma of the area, and also send signals to teach the brain that the movements that you're trying to perform are safe. So there's a lot of great research supporting movement. Obviously, you want to do it in a gradual way. Most people can return to work within 1 to 2 days. Many can, it typically depends on the work that you're doing, though. So if you're doing a lot of manual labor, likely I don't recommend doing a treatment, the day of, or maybe giving it a day or two of rest before going back to manual labor. But the real thing that I try to communicate is that this treatment is not a drug. So I'm not giving you something that takes the pain away. What we're doing is we're establishing a process, a cascade of events that will regrow tissue. So obviously, this will take some time. And regrowing of the tissue is the objective, and pain relief is the side effect. And that typically takes multiple treatments, and anywhere between a few weeks to, in some cases, 3 months. So that is something that I do try to communicate with people. And how many treatments and how often? Well, everyone is different, but I find most people fall within this category of 1 to 6 treatments within the course of the year. And that depends on many factors. And usually I can get a better idea of when people come in on what they might expect for frequency of treatments. Now, here's a big one. So cost of treatment. And this is a very important slide because, financial health is part of that holistic model. And it's important to understand it. Now, it's clear that these treatments are elective, and they can be quite expensive. And I find that if I communicate clearly with the expectation of what cost is, people can really understand what is available for them and what's worth it for them, and how we can strategize with other techniques if it is too expensive. But most of the cost is dependent on a couple factors. But here in Integrative, our treatments for prolotherapy range anywhere from $335 to about $450. And then for PRP, it ranges from $685 to a bit over $1,000. Now, a lot of people ask why it is so expensive. Well, typically medical procedures tend to cost more than the sum of the time and the resources used, but the value does include the considerable costs of time and training, and insurance, and the acumen of the practitioner. Here at Integrative, we find that we hold our doctors to a high standard, and our cost is we try to keep it as competitive as possible, but our costs do reflect this. It's important to note that skill does play a role. There's no real cookie cutter methodology for people, and we really try to ensure that people's goals, number one, people's goals are met, and that we provide the best possible treatment, not just with regenerative injection therapies, but with other ways to ensure that we promote the best possible outcomes. So prolotherapy and PRP are as listed here, but I will make a note of stem cells and exosomes. And stem cells and exosomes are kind of the strongest material that is used in that orthobiologics and regenerative injection therapies. Unfortunately, it's not as available here in Canada. However, we do have a referral network in the United States as well as down in Mexico. So if patients do require this treatment, that's the areas that we would send them. Dr. Grant Pagden in Kelowna is a doctor, the only doctor that I know of and I refer to here in Canada that has an FDA approval to use stem cells. And he charges about $8,000 per knee or hip. Oh. Okay, so other treatment considerations. This is just a quick list of things that I've spoken about before. Obviously, we take into consideration the cost of treatment. We never want to put someone in a position where they can't afford things in their own health by doing these treatments, and that is very important. And we make sure we meet people where they are. I try to communicate that there is some discomfort in the procedure. So if this does impact your life, we can strategize on ways to either make it work for you or find other solutions. And compliance with treatment. Now this is pretty important, because if someone chooses to utilize these techniques, I do try to stress the importance of trying to do it as complete as possible. If we're really going to put effort into regrowing your tissue, sometimes it's important to understand that the best chances of doing it are doing it right. And then that's just something I like to communicate. And obviously the recovery process, sometimes it takes a couple days to a couple weeks for someone to recover after a treatment. Now, how we're coming here to the tail end of the webinar, but I do want to address how effective are these procedures. As I said before, there is, excuse me here, there is significant amount of research done on these procedures. Now here, prolotherapy shows the effectiveness of prolotherapy in treating knee osteoarthritis in adults. Systematic reviews are done regularly on many different kinds of studies to kind of look at the collective average outcome of what has happened. In many of these systematic reviews, it comes in favor, it shows favor in prolotherapy and in PRP as well. But there are still many arenas of medicine where this is not accepted, and I think the reason being is because it's difficult to utilize the studies in conventional medicine to study these things. Treatment of complex chronic pain syndromes is not linear, and when we utilize these techniques, it's not utilized in a linear fashion. And for example, if someone comes in for neck pain, I wouldn't just do a single injection in that area. I would investigate other areas that may be contributing to the different factors of that neck pain and treating all those areas. And I think that model, that patient-centered approach, and that really complex method of using some of the tools that we have is very hard to study. And I think that this is reflected on some of the conventional techniques of understanding research. But surprisingly, even with that prolotherapy and PRP, platelet-rich plasma, is coming out with overall a good outcomes. So, and here's just another comprehensive look at the treatment of low back pain with platelet-rich plasma. It's interesting to note that these treatments are more widely utilized in areas outside of North America. So Europe, the UK, Germany, Sweden, Dutch, Japan, China, areas in North Africa have been utilizing regenerative injection therapies for a long time. And that's really where the research is coming out of. So improving outcomes. Again, to kind of wrap it up into the whole holistic approach of medicine, it's important to understand that the investment into any particular treatment plan, we need to utilize as many tools as possible. And we'll utilize all modalities of naturopathic principles to improve someone's overall health, because that is improve the outcomes as well. So nutrition, just a little blurb here on nutrition. We want to make sure that nutrition is the cornerstone of naturopathic medicine, and food is medicine. And I can't emphasize this enough, that your body will function and heal better if the right foods are being provided for you. And like injection therapies, nutrition is difficult to study, and it's really important to understand that food is not a one size fits all, and we really have to define what is good for you. And I put a lot of considerable effort into that, and understanding not only what works for your body, but what works for your lifestyle, what works for your culture, what works for your family, because these really play a role into the holistic aspect of food. And here's just another, I don't want to beat the drum too hard on that, but food's very important. And the other aspects that I really like to emphasize that help with these regenerative injection therapies is movement. And, movement is key, and it allows the tissue to heal in the ways that we need it to heal. So as you're going through that remodeling phase, I try to get people to utilize their bodies the way that they want it to. And that will reinforce the tissues to heal in that way, to have that tensile strength to do the activity that you want. And sleep. Sleep is very overlooked, and we want to ensure that you are sleeping as best as possible, because it is the body's most regenerative state. And I have a lot of techniques to help people with that as well. So last couple slides here. And here at the clinic, if you guys, it seems like everyone here is already a patient here. So we do other things as well. Chiropractic adjustments, soft tissue manipulation, neural therapy, or little percutaneous injections of neural prolotherapy. These can all help with any complex pain picture, because sometimes it's not just tissue damage. Sometimes the nerves start to flare up. Sometimes the brain has messages that it sends even though the tissue is healed. So we do have to really address those also. We also have a wide referral network here. It's important to understand that sometimes it takes a team to share the responsibility of patient health. So getting help from physiotherapists, group training or personal training, holistic nutritionists, clinical counselors and therapists, and even medical doctors. We all have to work together to help heal your body. And just as a final summary of everything that we've covered, because we did cover quite a bit, and I hope I didn't talk too fast, and some of the information was able to osmose in people's brains. But we talked about what our RIT, or regenerative injection therapies, are, who the candidacy for who this is for, the various treatment areas that we look at, how it works, what to expect, and the effectiveness, and how we really make those outcomes as good as possible for patients here.